We'll be discussing on anti-seizure drugs that are used to treat seizure. So we're discussing on it based on introduction. We'll classify seizure, classify anti-seizure drugs, talk about the mechanism of action of anti-seizure drugs, talk about some specific agents, some specific anti-seizure drugs that are commonly used. So let's quickly start. Seizure is different from epilepsy. How so? Generally in the brain, we have what we refer to as cerebral neurons, the neurons in the cerebral cortex. They are responsible for controlling our movements. They are responsible for controlling our voluntary activities. Now, when they are overexcited, abnormal firing of those neurons cause excessive movement, and that can cause seizure. So seizure is a neurological condition that is characterized by abnormal rhythmic firing of the cerebral neurons. They are overly excited. Now, when this seizure occur repetitively, not just once, not twice, there are episodes of this seizure. That's what we now refer to as epilepsy. So epilepsy simply is a chronic disorder that is characterized by repetitive episodes of seizure. That's what we call epilepsy. Now we'll move on to classification of seizure. Seizure can be classified into two broad groups. 1. Partial seizure. 2. Generalized seizure. For partial seizure, only a part of the brain is actually affected. So it affects a part of the body. Do you get? That's partial seizure. Partial seizure is divided into 3 types, which include simple partial seizure, complex partial seizure, then partial seizure that are secondarily generalized. They start from a part of the brain, but they can spread to all parts of the brain. That's partial seizure that are secondarily generalized. Now, generalized seizure are grouped into 1. Tonic-clonic seizure, which we also call grand mal seizure. Once you know tonic-clonic seizure, you now know we have tonic. For you to have tonic-clonic, there's one that is just tonic seizure. Then one that is just clonic seizure and myoclonic seizure. Then there's what we refer to as atonic seizure. So once you know tonic-clonic, we have just tonic seizure. They have clonic and myoclonic. Then atonic. Do you get? Then you now remember absent seizure, then infantile spasm. Now, absent seizure is a form of seizure that occurs when somebody loses consciousness for some maybe 20 seconds. For 20 seconds, you just lose consciousness. You don't know where you are. If you are holding an object, you just fall down from your hand. Just lose consciousness, then later you gain your consciousness. That's what we call absence seizure. Here we are not explaining seizure here, like trying to explain them. What we want to do is the drugs that we are concerned about. All right, so let's quickly go to classification of anti-seizure drugs. Anti-seizure drugs are actually drugs that are used to treat seizure. They have heterocyclic ring structure. They have a ring structure and other things attached to that ring. The other structures that are attached to the ring determines the chemical nature and chemical group of that drug. Let's quickly classify them. I would like to make the classification very easy, so I will be using this mnemonym: AA, BB, HOS, meaning house of success, then IN. This can help you to remember them. Where the first A means acetylureas. Example of acetylureas is phenacemide. The other A means aliphatic carboxylic acid. And under that region, that's where we have valproic acid. The B there stands for barbiturates. An example of barbiturate is phenobarbital, also known as phenobarbital. We also have primidone and we have methylbarbital. You can see the example of barbiturates. Then the other B is benzodiazepine. Example of benzodiazepine. So you have diazepam, very common. Clonazepam. These are example of benzodiazepine. Then so we've seen AABB, acetylurase, aliphatic carboxylic acid, benzodiazepine, barbiturates. So let's go to HOS, house of success. H means hydratoin. So an example of hydratoin is phenytoin. You can see it's ending with toin. Then mephenytoin. It's an example of hydratoin. Okay. Then you have O means oxazolidine dione. For zazolidine you can see ends with dione. So we have example dimethyldione, trimethyldione, also ending with dione. Then S means succinimide. Example of succinimide, etosucimide, ending with mind also. Finsucimide, ending with mind also. Take note of these drugs that are used to treat absence seizure. We'll talk about them as we are going. So after HOS, remember IN. I means immunostimine. Immunostimine. Example of immunostimine, that's where you have carbamazepine. Carbamazepine. We'll talk about the drug. Then N means newer agent. Example of newer agent, that's where you have things like gabapentin, topiramate, vigabatrin, lamotrigine. This is an example of newer agents. Then miscellaneous, we have something like acetazolamide. All right. So we are through with classification of anti-seizure drugs. So just remember, if they should ask you classify anti-seizure drug, you can classify AA, acetylurate. The other A, aliphatic carboxylic acid. BB, benzodiazepine, barbiturates. Then HOS, hydrantoin. Then ozazolidine, then succinimide, then IN, immunostimine, and then lastly N means newer agent. Give their examples, you are good to go. Next, let's go on to the mechanism of action of anti-seizure drugs. All right, mechanism of action. It is very important to explain this mechanism of action very well. Do you get? Because it's an exam question. Discuss on the mechanism of action of anti-seizure drugs. Okay. Now, first of all, remember in seizure there is excessive stimulation of the neurons of the brain. So if you want to help somebody that has seizure, you want to inhibit excitation. You want to bring about things that can inhibit the activities of those neurons. Inhibitory neurotransmitters can do that. Now, calcium channels, sodium channel, they are responsible for majorly excitation. So any drug that can inhibit sodium channel within the brain, make them inactive, it can be used. So that's the first mechanism of action, inhibition of sodium channels. Some anti-seizure drugs work by that way. Other anti-seizure drugs, they increase inhibitory neurotransmitter in the brain. Increase in inhibitory neurotransmitter activity in the CNS. That will help reduce the excess stimulation. Then another mechanism of action is reduction in excitatory neurotransmitter. But the excitatory neurotransmitter are the ones that are causing this excitation. So decrease in excitatory neurotransmitter can help. This is another mechanism of action. Then the last mechanism of action is inhibition of calcium channel. All right, so let's start with the first. Inhibition of sodium channel. So sodium channel is actually made inactive, placed in an inactive state by some drugs. These drugs that helps to place sodium channel in inactive state, therefore prevent the excessive stimulation of those neurons within the brain, those cerebral neurons. Now you must know example of drugs that act by inhibiting sodium channel, that makes it inactive. They include drugs like phenytoin, drugs like remember phenytoin is an example of hydrantoin, drugs like carbamazepine is an example of what? Immunostimine. Valproate or valproic acid is an example of aliphatic carboxylic acid. Topiramate and lamotrigine are an example of newer agents. So you can see these are the drugs that inhibit sodium channel. All right. Now the next group of drugs we'll be talking about are drugs that can increase inhibitory neurotransmitters. Now you must know this very well. The common inhibitory neurotransmitter in the brain is GABA. Though we have glycine as inhibitory neurotransmitter, is not a major inhibitory neurotransmitter in the brain. The primary inhibitory neurotransmitter in the brain is what? GABA. Now, there are some drugs that can bind to GABA receptor. Once they bind to GABA receptor, they act as if they are GABA. They increase the activity, or as if it is GABA that is binding. We refer to those drugs as GABA mimetic. They mimic GABA to increase inhibitory neurotransmitter. They cause inhibition of those neurons that are being excited by acting as if they are GABA. Then there are some drugs that how they act is that they facilitate the activities of GABA. They help GABA to work better. Do you get that? So these ones are called GABA facilitatory. So there are some drugs can actually help to reduce seizure or solve the issue of seizure by increasing inhibitory neurotransmitter, which is GABA. How do they do that? That's the first mechanism there. They said the first one, there are some drugs that increase GABA mimetic and increase GABA facilitatory action. Do you get now? They mimic GABA, they act on the receptor as if they are GABA to increase inhibition, and they also facilitate GABA, make GABA to work better to increase inhibition. Example of such drugs that are GABA mimetic and GABA facilitatory is where we have diazepam, example of benzodiazepine, clonazepam, another example of benzodiazepine, phenobarbital, which is also known as phenobarbital, which is an example of barbiturates. You get now? These drugs are an example of GABA mimetic and GABA facilitatory. They increase inhibitory neurotransmitter. All right. Another example of drug we'll be looking at is what we refer to as drugs that increase the release of GABA at the neuronal terminal. These ones, they don't help GABA to work better, but they increase the release. Generally, neurotransmitters are stored in vesicles. They increase the release of this neurotransmitter in the neuronal terminal. Example, gabapentin, a newer agent. So these type of drug increase inhibitory neurotransmitter. Do you get now? All right. The third mechanism of action, still on that, how to increase inhibitory neurotransmitter, are drugs that will decrease the metabolism of GABA. When GABA is found in the junction after it has been released, where it is acting for some time, within some time, it will be broken down. It will undergo metabolism, and then excitation will continue. However, there are some drugs that decrease the metabolism. It does not want GABA to undergo metabolism quickly. So GABA spends a longer time in the neuronal junction, and it helps to cause more inhibition because it spends a longer time there. Example of drug that does that is vigabatrin. Vigabatrin actually acts by decreasing the metabolism. They will ask all of this in exam. They will ask. Then the next, which is the last here, is decrease in the reuptake of GABA. When GABA is in the synaptic junction, there's a tendency for it to go back to the presynaptic. And once you go back to that presynaptic neuron, it's not active there. It is that synaptic junction, in that junction, that it's normally supposed to act. So there are some drugs that decrease the reuptake of GABA. GABA will remain in that synaptic junction. It will not undergo reuptake. Example of such drug is where we have tiagabine. So remember the drugs that helps to increase inhibitory neurotransmitter. For just recap purpose, some of them are GABA facilitatory and GABA mimetic. They mimic GABA and they facilitate the activities of GABA. Example is where we have those benzodiazepine example. That's diazepam, clonazepam, phenobarbital. Those are examples of GABA mimetic and GABA facilitatory drugs. We also mentioned drugs that increase the release of GABA in the neuronal terminal. We mentioned gabapentin. Take that one, increase GABA in the neuronal terminal. Drug that decrease the metabolism of GABA. Under that, we talk about vigabatrin. Then drugs that decrease the reuptake of GABA. And under that, we talk about tiagabine. These are all example points. So we are through with the second mechanism of action. The third mechanism of action, drugs that decrease excitatory neurotransmitter. Excitatory neurotransmitter are the cause. Yes, excessive excitation. So you want to reduce this excitatory neurotransmitter. The major excitatory neurotransmitter that we have in the brain is glutamate and aspartate. There are two examples: glutamate and aspartate. For glutamate and aspartate to act, they normally act using receptors. The receptors that they act on can be metabotropic receptor or ionotropic receptors. There are different examples of ionotropic and metabotropic receptor that they bind to. Example is where you see something like kinates. Example, NMDA, AMPA. These are receptors that glutamates bind to, receptors that aspartates bind to. Now, if you can actually inhibit those receptors, you can actually block those receptors. Will this excitatory neurotransmitter have a receptor to bind to cause excitation? No. So some drugs like valproate, which is valproic acid, aliphatic carboxylic acid, it causes inhibition of NMDA receptor. Once NMDA receptor is inhibited, can glutamate now bind to it again? No, it cannot bind to it. It cannot cause excitation. Topiramate, a newer agent, inhibits the activity of a kinase receptor. So all these excitatory neurotransmitters have nowhere to bind to anymore, and therefore excitation is reduced. So this is how this drug can bring about what now? Reduction in excitation and treatment of seizure. Last but not the least, because it's a very important mechanism of action, is inhibition of calcium channel. Now, calcium channel in the thalamus. There's a calcium channel in the thalamus. This calcium channel is a slow calcium channel. Take note, in the MCQ, you put fast calcium channel. This calcium channel is a T-type calcium channel, not an L-type calcium channel. So remember, a slow T-type calcium channel is found in the thalamus. Now this channel, once calcium is passing through it excessively, it can cause what we call absent seizure. I've already explained what's absent seizure. Loss of consciousness for about 20 seconds, things drop from your hand, you don't know what happens during that period of time. Now it is this channel that is responsible for it. Now, if you can have a drug that can inhibit this slow T-type calcium channel, you'll be able to treat absent seizure. And that's where some drugs come in, some anti-seizure drugs like etosusimide. I said, remember etosusimide? Yes. Finsusimide, valproate, lamotrigine, they are drugs. But the drug of choice, remember, etosusimide, it blocks this slow T-type calcium channel. And as it blocks that, it's able to treat absent seizure. So that's that on that for the mechanism of action of anti-seizure drugs. Next, we'll now talk about some specific anti-seizure drugs. And this is for theory purpose because they may just be discussed on the following drugs: phenytoin, carbamazepine, maybe there, etosusimide, maybe there. So you should know this. So this is what we'll be discussing on in the part 2. So please click on the part 2 of this video and watch.